Okay, ma'am, I'm ready.
Okay, so if you've read and understood, considering its surgical pathology station, what are the differential diagnoses you'll consider for this lady?
Ma'am, my differential diagnoses are giant cell arteritis, migraine, transient ischemic attack, or cluster headache.
Okay. How would you confirm your diagnosis? What investigations would you ask for?
Uh, the early investigation is ESR and CRP, but the confirmatory investigation in this is temporal artery biopsy.
Okay. How how much percentage is it confirmatory? It's not confirmatory
Uh,
in 100% cases, even the biopsy.
uh, this I don't know, ma'am. Sorry.
50%. Okay, what is joint cell arteritis if I ask you to define it?
Yes, it is granulomatous inflammatory disease of the large and medium-sized vessels of the head, mainly the branches of the external carotid artery.
Okay. Uh, if you tell me epidemiology of it, who is most or what are the risk factors for joint cell arthritis?
Okay, female are prone to develop giant cell arteritis, and old age is also a cause, a risk factor, and also patient who have immunological diseases like polymyalgia rheumatica are also at risk of developing giant cell arteritis.
Okay. What is the mechanism or pathogenesis behind joint cell arthritis?
So in this, actually, the arterial segment has intimal thickening that causes thrombosis and occlusion of the lumen. And also there is the classic lesion is medial granulomatous inflammation of the internal elastic lamina that causes the fragmentation of the internal elastic lamina. And there is infiltration of T cells along with macrophages, CD4 more as compared to CD8, and there are also multinucleated giant cells. And there is focal destruction of the vessel and sparing the long segment of the same vessel.
Okay, which interleukins are involved in joint cell arthritis?
Sorry, ma'am.
Interleukin 6, 17,
Okay.
and 21. Okay. All
Okay.
right. Do you think doing an ultrasound at the temporal area would be of any help in diagnosing this
Ye-
patient?
Yes, ultrasound temporal artery in the early days is helpful before starting the corticosteroids till before starting the corticosteroids. If it is before 7 days, ultrasound can actually give two signs, which is halo sign and compression sign. The
Okay.
temporal artery would not be compressible, and halo sign is actually the edema of the temporal artery.
Okay, good. Why do you think this patient complains of transit loss of vision only in her
Because of
left eye?
Yeah, because of the involvement of the ophthalmic artery, which gives end artery, retinal artery to the retina of the affected side.
After you have established your diagnosis, you want to treat this lady. How would you go about treating her?
I would start with the corticosteroids. I can give prednisolone 6 mg per day. Or if there is development of MRCS fugax or development of loss of vision, I can also give IV methylprednisolone. And this treatment is for 2 years.
Right. Before writing steroids for this lady, what are the things you have to keep in your mind?
Uh, Before starting steroids, if patient is diabetic, hypertensive or not, or
Comorbidities on one thing. Second, she's female, right?
yes, so she may,
Postmenopausal. So
yes,
she's already susceptible to
she's already
osteoporosis.
susceptible to osteoporosis
Yes.
and
And giving,
avascular necrosis.
yes, and giving her steroid will actually contribute to all the risk factors which she is already carrying out. So, what are the risks of giving her steroids or corticosteroids in this age group?
Yeah, she may develop osteoporosis or avascular necrosis.
And could even lead to pathological fractures.
Yes.
Okay, right. What other conditions or what other conditions can cause pathological fractures?
If there are skeletal metastases, if there's Paget's disease, osteomalacia, or multiple myeloma, they can also cause Paget's disease. Or if there is hormonal irregularity or imbalance like hyperparathyroidism or hypothyroidism, that can also lead to pathological fractures.
Okay, what is osteoporosis?
Osteoporosis is a metabolic bone disease in which there is decreased bone mass with normal.
Normal. Your voice disappears. Okay,
Yes, there is
bone
decreased bone.
fragility. Yes.
Yes, there is decreased bone mass with microarchitectural deterioration of the bone matrix, and there is reduced bone. There is increased bone fragility and reduced bone
Is there a
matrix.
way this can be confirmed?
Uh, yes, bone density scan uh,
Okay,
can be
and
done, and X-ray can tell us about the density, and
all
we
right.
can also go for serum calcium or vitamin D levels that can also tell us if the
Yes,
patient is
and okay, and calcium, vitamin D, and
uh,
calcium. Levels, ALP levels can be also assessed. Okay, since this is an elderly female, what other risk factors is she carrying which can lead to osteoporosis?
old age and post-menopause
And
are also risk factors, and female are
yes,
also at risk.
and family history,
Yes,
European or Asian ethnicity, smoking, steroids, taking heparin, alcohol, and
yes.
yes, all right, okay. If she presents a year later with a neck of femur fracture, how would you manage her?
Uh, so if she presents with neck of femur fracture after taking steroid for a year,
1 year
so
of, yes,
yes, most probable causes are avascular necrosis
yes,
and postmenopausal osteoporosis.
yes.
And this patient would be managed uh, with the supplements like calcium, vitamin D, and bed rest, along with some bisphosphonates. Yes, bisphosphonates are bone minerals that make the bone.
Yes, but how are you going to take care of neck of femur fracture?
Uh, we need to do total hip replacement, but and also need to give her these supplements along with total hip replacement.
Okay, since patient is already taking steroids for 1 year, what are your major concerns before you go ahead with the surgery?
So my major concern would be Addisonian crisis
Very
as
good.
patient is taking steroids.
Mm,
So we need to convert these steroids to IV hydrocortisone and give
yes.
more dose of steroid before surgery.
And you have to make sure you take proper history before taking her to the theater, because if she's taking steroids regularly or not, this you have to rule it out as well.
Yes.
Right. Okay. Okay. Any other condition that you're okay? What is the minor concern? This was your major concern. What would be your minor concern?
Minor concern would be DVT. That's also a major concern after
Yes.
neck of fracture, DVT, and pulmonary embolism. So for that, we also need to do preventive measures like TED stocking and intermittent calf compressions, and also
You also have to discuss it
there
with
are few
endocrinologist.
electric intermittent compression devices.
Okay. You also have to
Yes,
discuss
and
it
also
with endocrinologist and ophthalmologist if needed. And she could also
okay,
suffer from metabolic bone disease. Good, very
okay.
good. Thank you.
Thank you, ma'am.